Yeah, now I know people have joined. Yeah. Welcome everyone. So today we are talking about the assignment for that's due in 2 weeks' time for you. So it's okay. So I've given a brief discussion of the assignment previously, but this is again more extensive one, talking in detail about the assignment. So your work, first of all, has to be a bit critical. It doesn't have to be just description, number one. Number two is that when you're writing down your assignment, please remember to reference your work. So Harvard referencing, it's the correct referencing to be used. And it's the referencing that you have to do at the end, that's the reference list. And also within the text, it has to be referenced, which is very important because referencing carries marks. So otherwise your work would be considered as plagiarized, because if you're not referencing, if you've taken some work from anywhere, you have to reference it. So we'll come to this now. So the fundamental essential principles that underpin the work of all health and social care practitioners. It is vital that workers understand and know how these apply, how to apply these aspects, which are the key to service provision. So, if, for instance, if you've gone for a person-centered practice, you have apart from that, you have effective communication and safeguarding and protection also in hand. So the skills used will be developed and assessed through your assignment, where you're critically thinking, you're planning, organizing, and showing you're managing time, you're researching and you're documenting and referencing, gathering information, note-taking, and making summaries. You're analyzing, your writing skills will be seen, your academic skills will be seen, your IT skills will be seen, and a reflection will be seen if you've done any reflection on your work. So reflection means that what have you done? What have you, your thoughts actually, and your views about anything. So your task one, so you're applying for a role within a local health and social care organization, and you're required to prepare a training resource for the interview, which will include number one, the definition of a patient-centered practice. Number two, an analysis of how person-centered or patient-centered ways of working contribute to continuity of care. Number three is a description of the role of safeguarding and protection in person-centered practice. Number four is explanation of the benefits of positive risk-taking for individuals who access your services. Now for this task, obviously it says that you're applying for this role and you're preparing a training resource. So this document should not be an assignment which is just a normal description. So if you're training someone for an interview, training, well, how does training have to be? Training has to have pictures, has to have, yeah, so it has, yes, it is being recorded, the session. If that's what anyone asked, I don't know. Yeah. So, okay, so this training resource should be in the form of a training manual. Instead of writing a lot of stuff, you're just writing definitions, you're just seeing how these work, this person-centered approach for continuity of care, describing the role of safeguarding and protection. Very good bullet points would be appreciated. So if you want to gain a merit, you should be able to analyze how the 6 C's of care underpin person-centered approach. We've talked about the 6 C's. And if you want a distinction, you would also want to analyze why it is important for health and social care workers to demonstrate person-centered values whenever they're working at their practice. Is task 1 clear to everyone? Yeah, so a training module or a training resource with all these 4 points in them. And you should want to be able to achieve a distinction. This is for everyone. So coming towards task 2, its communication is a process. So we're talking about, again, communication skills. We've talked about it in detail, barriers, the methods, and how to make communication best for your patients, and when it is person-centered, how does communication play a role? So it involves, what does communication involve? It involves sending and receiving messages, and it's a continuous way which is repeated and becomes an important part of all relationships. So you're using a health and social care setting that you are either familiar with or have seen it in media. So there's some social care setting that you have to give an example of. You're going to assess the methods of communication used by people who are accessing the services and the people who are working there. So the service users or the patients and the people who are working there, the staff, how are they, what methods of communication are being used. So you're assessing the methods. So you're preparing a report based on your assessment of the communication methods used. So in this report, you're describing the role of communication in health and social care. Why is it important? What is its role? Explain the methods used in health and social care. Generally, what methods are used? Identify barriers to communication in health and social care. This is particularly talking about the barriers that you've assessed in your healthcare setting. So you might want to explain just briefly, what are the methods of communication generally? And then you would want to go and talk about what methods of communication are used in that setting. And then describing information handling, recording procedures, and then explaining the principles and practices relating to confidentiality in health and social care. So these are the 5 points that you have to cover in a report. In the report should again be in the form of which a report should be in. So it shouldn't be description and a lot of stuff into it. It should just be a report with headings, subheadings, and a lot of bullet points. And it should be succinct. It shouldn't be too elaborative, but it shouldn't be too very brief as well. So just make sure that whatever you're doing this, just have a look at how reports are developed and how they are prepared and what are the main necessities for making a report. So you might want to have a table of contents at the beginning, and you would have to have page numbers in your document. So in order to gain a merit only, so you evaluate factors that could influence the maintenance of confidentiality in health and social care. In order to get a distinction, you should be able to evaluate strategies that are used in health and social care settings in order to overcome the barriers to communication. Is that clear? Task 2 should be clear. So task 1
is clear.
So we'll go ahead with task 3. For now, task 3 is again, it's a training guide that you have to prepare. So when people access health and social care services, there are infections that can be serious. We've talked about infections, how they spread, different terminologies regarding infections. They could be life-threatening at times if they're spread in the hospital, and regular contact with staff, others using the service, and family members, friends, all infection can easily be transferred around. So this is important to help prevention. Prevention is always best. So when you have a social healthcare setting, or let's say you have a social setup, you should be making sure that people who are unwell, they need to be prevented from further on having more infection or spreading that infection. So you're preparing a training guide. This is a training guide that you have to prepare for staff that are new to the health and social care sector. So the three things that you have to explain in this is, number one, explaining the cause and spread of infection. You can use pictures in this. You can use diagrams in this. Please remember to label the diagrams. Please remember to reference these diagrams because they're not prepared by you, definitely. And then explain the importance of preventing and controlling the spread of infection. And then to explain how to reduce the spread of infection. So cause and spread of infection, importance of preventing and controlling spread of infection, how to reduce spread of infection. So three important points. So to gain a merit, you would analyze how you would investigate an outbreak. How would it be managed in the health and social care setting? If you want a distinction grade, you would want to assess how risk assessment would contribute to reducing the spread of infection in a health and social care setting. Is that clear? I hope that's clear. Any questions, please feel free to ask me now. Okay, so next is task 4. So using a health and social care organization of your choice, so it could be a home or a healthcare setting, you carry out an analysis and review of their approaches to partnership working. So your work revolves around partnership. In your review, so you should have these 4 points in it. So you're describing different work relationships in health and social care settings. Explain the role of an advocate. We've talked about advocates, what advocates could be, what are the characteristics of advocates. So what is their role in supporting individuals who are accessing services? Why are they important? What do they do? Explain why it is important to work in partnership with others, and evaluate the role of teams in providing coordinated approach to service delivery. Now, in order to gain a merit, you would want to analyze how team leadership can address challenges faced by team. Your leadership, so your team has a leader. So obviously, how would they address challenges that are faced by teams in health and social care? And then your 5th task, I hope that's clear, the 4th task. So there are different kinds of plans that are used in health and social care, have the same purpose, and that is to ensure that the person gets the same care at all times, to ensure that the care given has been recorded, to support the person to identify, manage, and hopefully meet their needs, wishes, and preferences. So it's patient-centered or person-centered. So you're supporting a person who's new to the service that you work at, and you're involved in preparing their care plan. So this person is very anxious and not at all sure what is involved in the care planning process. You have to prepare a short information leaflet. Now, remember, leaflets are very short. They're just a 1-pager, not very long, and have a lot of, they would be pictorial so that that person who's very anxious does not have to read through it. Probably the reading is also a problem for them. So you have to give these 3 points in them. Explain the purpose of care planning. Why do we do care? Why do we plan care and support? Outline the roles and responsibilities involved in the care planning process, so they know who to get to, whose role, who carries what role, and what are their responsibilities when there's the care planning process in hand, and describe how to ensure the individual is involved in all the stages of care planning and review. So again, to gain a merit only, you analyze ways to overcome barriers to implementing care plans. We've discussed this in detail. And then to gain a distinction, you would critically review the challenges of developing care plans that would meet the needs of the individual and their agreed outcomes. So critical analysis is very important. Whatever you're doing should be there. Yeah, this is the last task. So I hope task 1, 2, 3, 4, 5 are clear. So in task 6, you're supporting safe and correct administration. Again, we talked about medications last weekend. So it's the key function of the roles of many carers who are working in health and social care setups. So you're reflecting on an occasion. Reflection, we talked about how important it is. You're reflecting on an occasion when you or someone you know were prescribed medication. You're carrying out research to enable, to help you to complete an account relating to this particular person's medication, and broadly to the administration of this medication. So in this account, you would have to describe common types of medications, their side effects. So this is, and their other, whatever effects they have. So all the effects that they have. So this may be the side effects and the positive effects as well. Explain the different routes of medicine administration. So you're explaining, so it has to be a bit more extensive. Describe how to administer medication safely and in line with current legislation and guidelines. You could make a use of a table, like we've given you tables in your document, in your presentation, and explain the records that are to be completed for the storage, administration, and disposal of medication. So if you want a distinction in this, you would want to analyze standard precautions for infection control while you're administering your medication. So that's about it. So whenever you're writing down any task, please mention that task in your document so that we know that your previous task has ended and this is your new task that you're working on. Any questions? So task 1 will be preparing a training resource for an interview. Task 2 will be communication, all about communication. Task 3 will be a training guide that you're preparing for a new staff for regarding to spread of infection. Task 4 is carrying out an analysis on work relationships and what do teams do and how do they support each other? What is the role of an advocate? Task 5 will be a short information leaflet. This is for anyone, a person who is anxious, not at all sure what is involved in care planning process that you're giving to them. And task 6 will be reflection on an occasion.
Hello.
So, yeah.
Please, can you scroll back to task 2, please?
Sure.
Task 2.
Yeah.
Thank you.
Mm-hmm. So I know there are a lot of tasks, but if you start doing them in line with your presentations, it's not going to be hard. I'm hopeful. And if
Hello.
you have,
Hello. Yes, please.
Yes.
These ones on my module. This section is still unavailable, so I can't even really do anything.
Do you have the module guide?
Yeah, I've got the module guide. It's still unavailable. It's showing
Okay,
unavailable.
I'll let them know. That's okay. Mm-hmm.
So when is it going? When are we supposed to submit this now?
2 weeks from now.
But 2 weeks from now, and I've not got access to it. That's another thing.
Sorry?
I said I've not got access to it, to this thing.
Okay. Yeah, I'll just email them. I'll let them know. Is that okay? Any more questions? Okay. So these
Excuse
are
me.
yeah.
Excuse me. Yeah, the previous last 2 weeks, I've not been, I was not able to attend, and I've not got it. There's no recording of it on the WhatsApp group.
Okay. Sometimes it's not on the WhatsApp group, it's on Moodle itself. But if it's not there, I'll let them know. I'll just, as soon as this session ends, I'll email them.
All right. Then.
Okay. Any more questions? So yeah, that's it from my side. If there are no questions, I'll email them and I'll let them know whatever your queries are. And I wish you good luck for your assignments. Just remember the notes that you've taken, the presentations will be uploaded. They'll be there to support you. If you need more support, please let us know. Is that okay?
Sorry, hello?
Yeah.
Yeah, hello. Is this a new assignment? Because I submitted the previous one like last week, like a week ago. This one you're talking about now is a new assignment.
There's a lot of background noise at your end. I'm not sure what you were saying.
Okay. I don't know. Are you hearing me now?
Yes, I can hear you, but yeah, I can hear you now. Yeah.
Okay, is it better now? Okay, I said, is this one a new assignment? Because I know I submitted one assignment already.
Mm-hmm.
Beside that one, is this one a different one from that one?
This is related to Unit-4, working in health and social care settings. I'm not sure which assignment you've submitted.
Okay, so maybe I'm gonna I'll check for it and I'll send it to you on the group chat to know which one I actually submitted.
The assignment, are you sending the assignment? Please don't send it on the group.
No, not the assignment. I've submitted it. They sent me a receipt that they've received the assignment.
Mm-hmm. Okay.
Already. Yes. So I don't know, is it the same one you're talking about, or is it a different one? This one is a new one compared to the one we did earlier.
Yeah, this should be a new one because this only would be submitted after you've completed your reading, your presentation. So your presentations were over last weekend, and we've just had this discussion now.
Okay,
so I'm
okay. Thank you. I'll go
yeah, I'm assuming it's a new one.
Okay, I'll go through it. Thank you very much.
Well, excuse me. The presentation you say, is it not Unit-3?
Again, I didn't get you.
Excuse
Sorry.
me.
Yeah.
The presentation you're saying, is it not Unit-3?
Is it not on what? Sorry.
Is it not Unit-3 you're saying with the presentation, the previous assignment is Unit-3?
This which this is based on Unit-4, what
This
I've
is
just
Unit-4.
taught you.
Yeah, and I know
Yeah.
this one is Unit-4. The previous one was Unit-3 that we have submitted. Yeah?
That should be Unit-3, yes.
Oh, that's what I want to know.
Mm-hmm. Is that okay?
Yes, it's okay. That's what I want to, because it's only Unit-3 we've done, and I've submitted that as well.
That's fine. Yeah, when you're doing a lot of assignment, it gets a bit confusing.
Yeah,
I agree. Yeah. So that's it from my side. Any questions? I'm happy to take them, and I'll just email them for sharing the links with you. Okay. So good luck to all of you. Take care of yourself, and bye from my side. Take good care. Bye-bye.
Yeah, bye.
Bye.
Thank you.
Bye-bye.
You're welcome.
Thank you.
Bye.